Hi there, I'm Martha Van Dam, and this is Living Beyond. And this month we are in Inflammatory Breast Cancer Awareness Month. Here's a surprising note for you. Physically, it's never really over for us. It's never over. We look at our breast cancer person or our person with any sort of cancer, and if they are fortunate enough to be able to finish their treatment, as in they are at a stage where they won't have permanent treatment for the rest of their life. So if they've finished their treatment, we tend to look at them and we think, it's over, don't you feel great? Yay, it's all over. Well, what you need to know is that for those of us who've had major cancers, physically for us, it's never over because our bodies are changed. Our bodies are different. This is not about woe is me, let's be the negative. This is about, if we're going to talk about awareness, let's really be aware. Let's really know what cancer is like for people who are dealing with it so that we can be supportive. So our bodies have been changed by the treatment. They may have been changed by the cancer. They most assuredly will be changed by the treatment. And so because of that, our bodies, therefore our lives, are different for the rest of our lives. That doesn't mean it's necessarily horrible. It doesn't mean we can't have full and wonderful lives, but it's different. We may, if we have had, so a person who's had mastectomy, it's an amputation, and it's depending on the type. Did you know there are multiple types of mastectomy? Depending on the type, the surgeon may have had to go deeper and deeper and take out more. So the more aggressive the surgery had to be, the more we are affected. Did you know that we will, if we've had mastectomy, and particularly a single mastectomy, we are forever and always not symmetrical. Our muscles aren't the same. We may be weaker on one side of our body than the other. We may have a difficulty in stretching and reaching for that tall cabinet. We may not be able to have to lift some of the things that we lifted before. With breast cancer, a certain percentage of cancer patients who have undergone mastectomy will also end up developing something known as lymphedema. That's because with later stage cancers, the lymph nodes are taken out from under in the armpit, from behind the breast and under the arm. The lymph nodes are taken. Well, if we're missing those lymph nodes, then our body doesn't process the lymph fluid the same way. And we can be affected by that. Some of it in very, very major ways. So that would be one way that our bodies are different. With regular breast cancer, I believe the percentage is 20% of women who have had mastectomy will end up having lymphedema, but it's much, much higher. That percentage is much higher with inflammatory breast cancer because the treatment is more aggressive. So since the treatment is more aggressive, more lymph nodes have been damaged or taken out, and therefore we are more likely to develop this lymphedema. With lymphedema, the arm, the affected arm, the arm where the surgery was done, will swell with lymph fluid, and it can't get out real easily. It often we have to have treatments to make it to help drain the fluid, but it can get to the point that fluid doesn't drain. You can't hardly get it out, and so then women end up having to wrap with special wraps. It's not just like I just grab a bandage and put it around. Special wrapping with graduated pressure, or wear a specific type of sleeve that they wear 23 hours out of 24 a day. Life is different with after having breast cancer. There's so many other lifelong physical effects. Heart damage can be an effect of some chemotherapies and targeted therapies. We can have, because of the scar tissue, we may have to continually have, we have to have massages. That's not real sad, is it? But still, continual treatment to continually release that scar tissue so that we don't lose range of motion and we don't bind up and lose ability. Another thing that sometimes people will have is neuropathy, which is from the chemotherapy, damage in our nerves at the end, most specifically at the ends of our fingers and our toes, although it can go further, hands, feet, it can go further up. So where a person is having neuropathy, it will feel, that feeling you get when your foot's been asleep and it begins to wake up and it's little pins and needles all over. Yeah, well, it can feel that way. Our hands, our fingers, our toes, it can feel like that, and worse, kind of like we're having little needles literally sticking in our, that can be a result of some of the damaging chemo. Sometimes there are treatments, sometimes there are medications to make that better, sometimes not. Sometimes they're not highly effective. So please understand that the idea that once treatment is over, it's all over, I wish that were the case. That's kind of an idea that we have. But once we actually go through cancer treatment, we realize that's not true. Our bodies are changed. They will forever be changed. And what I'm asking you to do, if you are the patient, is be gentle with yourself. Learn new things to help your body recoup and recover. There are many, many, many things that you can do that can help your body in its recovery so that it can get over a lot of the leftover effects. Maybe even finding a way to get a personal trainer who is experienced with post-cancer treatment. Maybe a nutritionist who can help you know the right foods to eat that can best help your body to recover. Finding the exercise that you can use that will help you, that will not also exacerbate some of the physical issues that you're having. So get involved with your own care and you will make it through this much better. To the person who does not have cancer, but your friend does, your loved one does, please understand that for them it's not over. So don't go to them with the idea of, don't you feel better? It's all over, because it's not. And you will be closer to your person. You'll be most appreciated by your person. You'll be able to be the best effect for them if you can be aware of that and you can be sensitive to that. And from time to time, ask them, hey, I know it's been 4 years. Do you have any leftover side effects, things that you're still dealing with? How has it affected your body leaving leftover? To be honest, if people were to ask me that right now, it would take me aback a little bit because I don't think about them all the time. I'm living my life. But if I had to sit down and give a list, if someone asked me, I could come up with a lot of ways that my body is very different. And ways that I've had to learn new coping skills and new ways to do things because my body is very different. So know that about your friends. Give yourself grace if it's you, and let's support one another. Thanks so much. Bye-bye.